in this series is a niacin vitamin. Niacin, it is also called as a nicotinic acid. Okay, this enzyme, this vitamin is also called as a nicotinic acid. Also, it is called as a pellagra preventing vitamin, PP, pellagra preventive vitamin. Okay, uh, pellagra preventive vitamin of Goldberg. So basically, Goldberg was a scientist who discovered. So this niacin or nicotinic acid, the coenzyme of niacin, that is NAD plus and NADP plus, can be synthesized by the essential amino acid tryptophan. Okay, so amino acid or protein consumption is very important. The disease pellagra, in Italian, it is in the Italian language, the pellagra means rough skin. So in the pellagra disease, the skin becomes very, very rough. Its relation to deficiency of dietary factor was first identified by the scientist Goldberger, who conducted experiment, and his associated conducted a very, very important and very interesting experiment. And what was that experiment? While I was reading, so for this testing, only testing. See, during those days, it was not a practice to follow the ethical systems or ethical things, especially for the prisoners. So prisoners, in this case, 12 prisoners were promised pardon. Okay. If they consumed the diet of the these pelagious families of 1 year. So this Goldberg promised that in this research he is going to feed this prisoner with the diet which will cause pellagra. Okay, and then if they accept that, they will be pardoned from their punishment. Okay, and that too they were fed for 12 months, like almost a year. And then the diet consisted which food? Okay, so only pure corn. It was like a corn meal, not corn, a whole corn, but a corn meal. Then corn starch. Sorry, this is corn meal. Then corn starch, like pure starch. Then only rice, only starch containing compound were fed. A sweet potato or potato. Okay, only starch and fat, a pork fat. Okay, pork fat, pure pork fat. So they were only given rice starch, corn meal, sweet potato, and pork. And you will be surprised to see the result that the subjects or the prisoners showed symptoms of the pellagra within 6 months. Not even, see, the study was agreed for 12 months, but less than 12 months, within 6 months only, the prisoners developed the symptoms of the pellagra. And there was also control group in which the prisoners, the another control group of prisoners, were fed with the regular diet. Okay, regular diet with the whole grain and all sort of things. So, and then in the next third stage, and these prisoners were normal, they did not show any symptom of pellagra. In the third case, these prisoners who showed pellagra symptoms were fed with the liver, and the pellagra got cured immediately. Okay, so the liver cured pellagra immediately. Okay, so this was a story, and that is why this vitamin is also called as a pellagra pp Goldberg. Okay, pellagra Goldberg, because of the Goldberger invention on this. So it was recognized as a vitamin, or nicotinic acid was well known as a chemical compound produced by the oxidation of this nicotine. But the term niacin was coined, and more commonly it is used for the nicotinic acid, and this was done to emphasize the role of niacin as a vitamin, and then avoid any confusion with this nicotinic acid, that is an oxidized form of nicotine. Okay, but then niacin should be used as a name. Okay, so what does its chemistry says? So niacin is basically a, if you see this niacin is a pyridine derivative, and structurally it is a pyridine 3 COOH. You see this carboxylic. So this is your COH, carboxylic acid. The amide form of niacin is also known as a niacinamide or nicotinamide. Okay, a reduced form. So nicotinamide linked to adenine dinucleotide or adenine dinucleotide phosphate, or in the form of oxidide. So coenzyme forms using nicotinamide. So dietary nicotinamide, niacin, and tryptophan, an essential amino acid, both contribute to the synthesis of the coenzyme called as a nicotinamide adenine dinucleotide, NAD plus. Okay, NAD plus. So how does this NAD plus is synthesized? So basically there is a long pathway. I'm not going to explain. So there is a whole multi steps biosynthesis pathway of nicotinamide nucleotide, that is NAD plus, from the these various like niacin and. So there are like many in which this niacin and tryptophan, which is an essential amino acid, they contribute the synthesis of this NAD plus and NADP plus. Okay, so this NADP plus is nothing but nicotinamide adenine dinucleotide phosphate. The pathway for this biosynthesis, and that I'm not going to explain. So this nicotinamide is basically in this pathway deaminated in the body. Okay, and then the further process takes place. Okay, so see, this is a nicotinic acid, nicotinamide, and a nicotinamide adenine dinucleotide, and then so both this NAD and NADP both function as coenzyme in the transfer of reducing equivalent in many dehydrogenase reactions. Heat, especially under acid or alkaline conditions, converts this nicotinamide to nicotinic acid without loss of vitamin activity. So both of them have a very good vitamin activity. This niacin is not affected by light, and no thermal losses occurs under conditions relevant to food processing, but the losses can occur during leaching, washing, bleaching, blanching, processing, preparation, or exudation of fluid from the tissue. It is called as a drip loss. For example, you have these leafy vegetable, okay, and then if you keep this leafy vegetable in the deep freezer, okay, so the tissues are frozen, and then when you thaw them, the drip loss takes place, or exudation of the fluid from the tissues comes because of the damage to the tissue because of the ice formation. So distributed vegetable foods of the animal. So diet high in protein reduces the requirement of niacin, because we have seen the protein requirement through metabolic conversion of tryptophan to nicotinamide. Okay, so there are multiple functions, this biochemical function, this coenzyme NAD plus and NAD plus are involved in, for example, various oxidation as well as reduction reaction that take place. They accept hydride ion, that is hydrogen atom, in one electron system, and they also undergo reduction in the pyridine ring, and this result into neutralization of positive charges, the nitrogen atom. So lot of oxidation reduction reaction they undergo. Okay, oxidoreductases. So if you see these cycles in lot of oxidation and reduction reactions, you see that your NAD plus and NADH, they get oxidized, reduced. So many places they are required, and without them these things will not happen. Okay, the many this So what is the occurrence of this niacin? Recommended daily allowance or dose for niacin is around 16 milligram per day in men, whereas 14 milligram per day in women. Okay, and for children it ranges between 10 to 15 milligram. Very often the term like niacin equivalence is used, basically for expressing the RDA, because one niacin equivalent is equal to 1 milligram of niacin, or 1 milligram of niacin, 1 milligram of niacin, or it is also called as a 60 milligram of tryptophan. Okay, one niacin equivalent is equal to, okay, so that is called as a niacin equivalent. So pregnancy, lactation in women impose on additional metabolic burden, because lot of metabolic reactions happens during pregnancy, lactation, so therefore an additional reaction or additional requirement for this niacin increases. So there are multiple number of dietary source. The rich natural sources of niacin include liver, yeast, fermented product that are prepared from yeast, whole grain, cereals, pulses, beans, then peanuts, milk, fish, eggs, and various vegetables are very, very good as well as moderate source. The essential amino acid that you, if you consume essential amino tryptophan, that can serve as a very good precursor for the synthesis of this nicotinamide coenzyme. So on an average 1 gram of a good quality protein. So we know that a see what is the protein. There are two types of protein: good quality and low quality. Good quality means the balance of essential amino acid. So if you consume a good quality protein, for example egg is considered as a very good, or whey protein. So 1 gram of good quality protein contains about 60 milligram of tryptophan, which is equivalent to basically 1 milligram of niacin. So if you converge, like here the conversion ratio is 60 as to 1. Okay, this tryptophan to niacin. So 60 milligram of tryptophan is coming from 1 gram of good quality protein. So 60 milligram of tryptophan is equivalent to 1 milligram of niacin. So for the synthesis of nicotinamide coenzyme, so tryptophan is very, very important. Okay, that plays a very, very important function in the body. So dietary tryptophan cannot basically replace that, we will see. Okay, so this niacin equivalent used while expressing its recommended daily allowances. So one niacin equivalent is equal to 1 milligram niacin or 60 milligram of tryptophan. So tryptophan has many other functions in body. Therefore, dietary tryptophan cannot totally replace. So you will say that okay, my body must be having tryptophan, I will not consume niacin. But then tryptophan cannot totally replace niacin. Increased conversion of tryptophan. Suppose you do not consume niacin. So what body will do? Body will tryptophan to niacin. So increased conversion of tryptophan to niacin, when does it occur? If you do not take protein in diet. Okay, so low protein in diet, or people are crazy, they do starvation a lot because of rituals or whatever reason. So if the person, or some people in our country also do not get food, they have to sleep hungry stomachs, and then there is a starvation. So low protein diet and starvation results into conversion of tryptophan to this niacin. So tryptophan can replace niacin to an extent to only 10%. Okay, for the synthesis of coenzyme. Therefore both niacin and tryptophan have to be invariably provided in the diet. Okay, you cannot skip. So how does the losses takes place? So cooking causes changes in the concentration of niacin compound through interconversion reaction. For example, if you heat the vegetable or fruit, this heating causes release of free nicotinamide from the NAD and NADP during the boiling. Suppose corn are very rich, whole corn, okay, corn grains. In addition, the distribution of niacin compounds within a product varies as a function of variety, like sweet corn versus field corn. There are in sweet corn also there are variety, stage of maturity. All that factors affect. So bioavailability of this NADH is reduced form of NAD, and presumably NADPH exists very low bioavailability, possesses very low bioavailability because of their instability in the gastric acid. We know that the gastric acid environment is highly acidic, so therefore it is like its bioavailability is poor compared to others. So analysis of this is important, because when as a food scientist, when you go to the industry and when you want to retain or restore the more thiamine in canned corn or peas or vegetables, so that time you need to understand how one can analyze. So a reaction of niacin with cyanogen bromide to yield an N substituted pyridine, that is then coupled to an aromatic amine to form a chromophore, and then this chromophore can be then measured either in the form of absorbance or fluorescence, or you can use another methods like HPLC or gas chromatographic method for measurement of nicotinic acid and nicotinamide in the foods. So what is the deficiency? Niacin deficiency result in the condition well known is called as a pellagra, and the pellagra meaning I already explained. It is called as in Italian language. It is called as a rough skin, and this disease involves skin, gastrointestinal tract, central nervous system, and the symptoms of the pellagra are like you can remember 3D, okay, or 4D maybe 3 or 4D. If you want to remember the symptoms, 3D, you call them as a 3D or 4D symptoms. Okay, so this is also progresses like it is also progressive report. Like initially you will see dermatitis, then diarrhea, then dementia, and then death. Okay, these symptoms are progresses in that order only. Okay, and if treated, if not, here 3D you remember, and if the treatment gets, then the person will not die. But if not treated, death occurs. Okay, it is called as a fourth D. Dermatitis, what is the dermatitis? Inflammation of skin is usually found in the areas of the skin that are exposed to sunlight, like basically neck or dorsal part of the feet or ankle or part of the face. So diarrhea may be in the form of loose stools, often with the blood or mucus, and prolonged diarrhea leads to weight loss, dementia, and and it is also associated with the degeneration of nervous system. We know that dementia is associated with the degeneration of the nervous system or nervous tissues, and the symptom of dementia include like anxiety, a person feel very irritable, poor memory, insomnia, you will not get sleep at all, like sleeplessness. There are so many people in the country who have this dementia or sleeplessness or anxiety, and particularly in this pandemic, such of course it is because of the mental disorder, but we cannot reject the cause of even deficiency of the vitamin, so insomnia or sleeplessness, etc. So this pellagra is mostly seen among people whose staple diet is only corn or maize and no other cereal grain, and corn doesn't have niacin. So niacin present in maize is unavailable to the body, as because it might have the thiamine or this niacin, but it is in the bound form. This bound form is not at all available. Further, the tryptophan content in the corn is negligible or very low, so you are not even getting tryptophan. Okay, you will think that through tryptophan, because the ratio is quite like low, like so it is very poor. Okay, so conversion ratio to tryptophan to niacin, because corn doesn't have even tryptophan. Okay, so this is like the condition of dermatitis, where neck and the area which is exposed to the sun will be affected due to this condition. Okay, there are therapeutic uses of niacin, that is administration of niacin in a pharmacological doses like 2 to 4 gram per day, which is almost 200 times the RDA, which results into number of biochemical effects in the body not related to its function as a vitamin. and most of the effects are believed to be due to the influence of niacin on this cyclic AMP levels. So there are like, what are those therapeutic uses? Like niacin inhibits lipolysis in the adipose tissue and decreases the circulatory free acid system, or triacylglycerol synthesis in the liver is decreased. The serum level of LDL, that is low density lipoprotein, or VLDL, very low density lipoprotein, triacylglycerol and cholesterol are lower. This is very important. Okay, so hence niacin is used in the treatment of hyperlipoproteinemia. Okay, in this case what happens, there is a, in this situation, a person having hyperlipoproteinemia elevates the LDL and VLDL level. So this to reduce this LDL and VLDL level, niacin is used. So although mega doses of niacin are useful for the treatment of this hyperlipoproteinemia or hyperlipidemia, but there are certain harmful effects also. Like, see, in the therapeutic uses you are using niacin to reduce the LDL and VLDL, but then mega doses may be useful, but then there are adverse effect also. And what are those adverse effects? The glycogen and fat reserve of the skeletal and cardiac muscles are depleted. There is a tendency for increased level of glucose, increased level of uric acid in the circulation, and that might result into even the worse situation. And if you do not stop there and there itself, the prolonged use of niacin result into again elevated level of certain enzymes, suggesting there is a liver damage. So more consumption of niacin as a therapeutic use may result into liver damage. Okay, so upper limit is around 35 milligram per day, but 1 to 2 gram is given in time release form. Okay, so the next vitamin is our vitamin B6, and